So you want to know about prostate cancer awareness? Well, in this video, you will learn all about prostate cancer awareness and why there are some major concerns about this program. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon, and this channel is all about routine medical conditions, self-care, and cash pay healthcare options so you can be informed and in control of your healthcare decision making. If you want to learn about routine medical conditions and self-care, tap the subscribe button below. We get contacted regularly by patients, employers, and providers looking for ways to ease their healthcare burdens. So feel free to reach out with an email or hit the comment section below. So here's what this video is all about. So what is prostate cancer awareness, or the Blue September program, all about? Why only some high-grade prostate cancers are potentially deadly? Why the prostate cancer screening test with prostate check and the PSA are highly unreliable, and that despite all the clever marketing, there is no evidence for life extension. Now, before we get into it, we have to let you know about the disclaimer. The information provided by HEALTHdrum is for educational and informational purposes only and is not a substitute for professional medical advice. Consult a licensed physician for medical advice, diagnosis, or treatment. You can pause the video and read it so you completely understand it. Now, it's very important that you realize that a lot of healthcare information is inaccurate. And to underscore this, I have a couple of facts listed in the next screenshot. So the conclusions of these two well-known studies underscore the undependability of healthcare information. This will come as an absolute shock to most people, but sadly, most published research is false, and only about 11% of medical treatments are of known benefit. Clearly, based on these facts, a lot of healthcare recommendations are not supported by irrefutable and reproducible data, so it's vital that you do your homework. In other videos, I've explained how healthcare is financially driven and that healthcare marketing is psychologically driven to sell a product. So what is prostate cancer awareness all about? Let's look at some of their claims and then measure these claims against facts about prostate cancer, especially when Prostate Cancer Awareness Month is a completely manufactured program that was designed by an advertising firm to market PSA testing, sell the product, and make lots of money. So let's look at some of these marketing claims for prostate cancer awareness. That prostate cancer is the second most common cancer after lung cancer, that some 300,000 men will be diagnosed with prostate cancer yearly, and that some 30,000 men will die each year from prostate cancer, but that survivals approach 95%. So here's how these claims have been manipulated. Most men diagnosed with prostate cancer live with their cancer and don't die from it. Only the 10 to 15% of high-grade prostate cancers are potentially deadly and responsible for the 30,000 or so deaths each year. Now, although the death rate may be falling a bit, this apparent fall can be easily explained by the unnecessary treatment of low-risk prostate cancers and/or better treatment of comorbidities such as heart disease. Clearly, overtreatment of low-risk disease will improve survival figures because these men were going to survive anyway. Moreover, the majority of prostate cancers are low and intermediate risk cancers, and these have very sluggish growth rates, taking some 40 years from the time of mutation to reach half an inch or a centimeter in diameter. This makes the marketing of 5-year survivals absolutely ridiculous. Even more appalling, the common Gleason 6 is still labeled as a cancer, although it's been known for years that its biological pathways for cancer development and spread are inactive. Therefore, the Gleason 6 is a bogus cancer, doesn't need detection, doesn't need monitoring, and doesn't need treatment. Yet, Despite all the claims about whether to have focal treatment or aggressive whole gland treatment for prostate cancer, there's no evidence that any treatment is curative. In fact, studies showed that at 15 years, whether you had surgery, radiation, or no treatment, survival was the same for all three groups. And again, I have links to these various papers in the description below. So let's talk about the two screening tests that are considered standard of care in the whole prostate cancer awareness program: the prostate check or digital rectal examination, and the PSA or prostate-specific antigen blood test. So let's look at this table. For a screening test to be useful, its reliability to detect significant issues should approach 100%. Yet the prostate check relies on an inaccurate impression by the practitioner as to whether the prostate feels normal or abnormal, and this judgment is no more reliable than a coin toss. As well, for the PSA or prostate-specific antigen, the word specific here is a barefaced lie, as the test is not specific for cancer or for the prostate. Furthermore, the test is associated with a false positive rate of 78% and is highly unreliable for detecting the few high-grade prostate cancers that are potentially deadly. Why? Because many aggressive prostate cancers produce little or no PSA, so that PSA testing is very unhelpful for trying to detect these important cancers. So let's look at urologists' own studies about PSA testing for prostate cancer screening and for prostate cancer awareness. After 10 years of follow-up, the rate of death from prostate cancer did not differ significantly between those that were PSA tested and those that were not PSA tested. So does PSA testing save significant numbers of lives? No, there is zero evidence that PSA testing saves significant numbers of lives. So if there's no evidence that prostate cancer screening with the prostate check and the PSA test save significant numbers of lives, what about treatments? Do prostate cancer treatments lead to significant life extension? So look at the conclusion of this study. At 15 years, the survival rates were similar for those that had surgery, radiation, or no treatment. These facts have been known by physicians for many years, but no changes have been made to the medical guidelines for localized prostate cancer. So physicians and government oversight healthcare agencies appear to be quite comfortable with continuing on with prostate cancer screening and prostate cancer awareness programs, despite all the evidence against these programs. There was one agency that did challenge the data and was concerned about patient welfare, and that agency was the USPSTF. The USPSTF, or the United States Preventive Services Task Force, an independent evidence-based organization of highly respected physicians, gave PSA-based screening a D grade in 2012 as the benefits of PSA testing and the treatment of screen-detected prostate cancers did not outweigh the harms. However, this important healthcare safety ruling was challenged by physicians and others in the business of prostate cancer, and this rating quickly watered down to an ineffectual C grade. So let's summarize the many concerns about safety and effectiveness of the Prostate Cancer Awareness Program. Although Prostate Cancer Awareness Month is celebrated every September as a potential lifesaver, the prostate check and PSA testing for prostate cancer are both highly unreliable, unsafe, and ineffective. Furthermore, PSA testing fails to save significant numbers of lives, and there's no evidence that prostate cancer treatments are life-saving. Instead, the Prostate Cancer Awareness Program exaggerates risks, exploits false hope, makes false promises, and leads countless men to serious harm. And, unfortunately, prostate cancer is not the only cancer in the healthcare arena where we have no evidence that treatments are curative. So in this video, we talked about prostate cancer awareness and the fact that the most important takeaway for you here is that you should be very aware that PSA testing for prostate cancer and prostate cancer awareness are highly unreliable, unsafe, and ineffective. Shockingly, many physicians commonly fail to challenge their own guidelines with the very simple question, where is the irrefutable and reproducible evidence supporting this recommendation? To learn more about routine medical conditions, check out these other videos.